This is Dr. Chris Marshall here at Medical Specialty Clinic, and today I wanted to talk real quick about the Dexcom G6. So you probably have heard about continuous glucose monitors, or CGMs for short, and there's two major brands. There's several different companies that make them, but the two major brands are going to be the FreeStyle Libre and the Dexcom G6 currently. Obviously there's been previous generations of those, but they are a really neat product, and we offer those here at the clinic, and I wanted to let all my diabetic patients know that. And actually, if you just want to monitor your sugar, you can get one of these and wear it and download the data off of it to see how your blood sugar is running. Some people want to do that just for overall health. Now, typically insurance does not pay for it if you just want to know what your blood sugar is, just want to monitor it. But if you are diabetic and you're on insulin, usually insurance will pay for a glucose monitor, or at least help cover a glucose monitor of some type. But the one I wanted to talk about today is actually the Dexcom G6 Pro. And the benefit of that is you come into the office and we put the monitor on you, and you wear it for 10 days, and you bring that in, and I can download the data. The Dexcom checks your blood sugar every 5 minutes, and I can download that data and print it out and look at it several different ways, and it really gives me a lot of information. You can see patterns, low blood sugar, high blood sugar, different times of day those things happen, and you can look back, and especially if you keep a meal diary, you can look back and see what meals you ate and how that affected your blood sugar. But it really provides a lot of information, and I can actually put that on in a blinded or unblinded fashion. So we can put that on where the patient cannot see the results, or they can see the results. All they need is a smartphone or a reader, and then they could read their blood sugar while they had it on. And then they bring that back in, we take it off, I hook it up to the computer, and we download the data off of it. So it's really pretty neat and can give us a lot of information. So if that's something you're interested in, come by and let us talk to you about it. If insurance doesn't cover it, I can put a Dexcom monitor on you for 10 days for under $100. The prices vary a little bit, but you can do that and we can get a lot of information. And then if you wanted to wear a Dexcom more consistently, then you can actually buy them. They're a little high, but not unreasonable. Usually I believe the Dexcom G6 transmitters are good for several months, and then the sensors are the part that sticks on your skin. They're good for 10 days. So that's the part that actually has a little sensor that goes into the skin and reads your blood glucose levels that way. So here are a couple of different things. So the Dexcom comes with an applicator to put on the sensor. So there's a big difference. There's a sensor, there's a transmitter, and then there's a reader. So this is just an applicator that you put on. It comes with the sensor. It comes with the sensor in it. It all comes stuck together, and then there's little adhesive stickers that you pull off. So you just pull that off, and it's got a code on it. You'd need the code when you put it in to be read on your smartphone. You put that code in for the sensor and a code for the transmitter. So anyway, you peel off those just like a band-aid. You peel the protective layer off, and then it's actually in the Dexcom. You peel off the stickers, you stick that on usually the lower abdomen, you press the button, and it inserts the sensor into the skin and sticks to the body, and then you kind of go around it and apply pressure and to keep it stuck in place. And then they actually make extra oversized stickers to go over that with a hole cut out in the middle to make them stick better. And you can go swimming with these on, it doesn't hurt them. You can get in the tub, in the shower, things like that. And then, I'm not sure you can see it, but there is a little tiny wire that sticks up through the sensor, and that's actually what goes in the skin, if you can see it. Just a little tiny filament that goes in there. It doesn't hurt to wear it or anything like that. You can feel there's something there, but it's not painful, and a lot of people use these. You can ask them. they're not a big deal. So this goes on the skin, and then you put this is a transmitter. You put the transmitter in, you insert it in that and snap it in place. And it's got two little electrodes there that connects it, and it can read that blood sugar, and then this transmits the signal either to your phone or a reader. So you just insert that when it's on your skin. You just insert the transmitter into it and then press it down, and it snaps into place. And then it goes through. When you pull this off, you actually bend this. It's got two little cutouts. You bend that open and then slide the transmitter out. You can reuse the transmitter, a regular G6 transmitter. The Dexcom G6 Pro that we put on in the office are only good for 10 days. The battery only lasts 10 days. And it'll give you a warning when the battery's running down on any of them. But the ones at home or the patient use transmitters last several months. And you go to the Dexcom website and check that out. I have nothing against the FreeStyle Libre. I just like the Dexcom. It's a little bit easier for me as a physician to use, but I'm sure there's other physicians that prefer the FreeStyle Libre. Not a big deal. Either one is fine. It just helps to monitor your blood sugar. That's the main thing. So anyway, that's the sensor, and then there's the G6 transmitter. I'll try to put some links to the Dexcom website so you can see their videos. They have videos that talk about the differences there. And then you can certainly use a cell phone to read the data, but I have a Dexcom reader. Then this can get the information from the transmitter wirelessly, and then once you put in the code, connect it downloads the information here, and then you connect that to a computer, you download it, and I actually upload that into what's called Dexcom Clarity, and has that information in there for long term, so I can look back and compare it to old readings and things like that. So Dexcom Clarity is the online storage for this information, so I can go back into Dexcom Clarity, years from now, and look back at that information, print out the readout, the report if I need to, get all the details and compare it. So really pretty handy. I really am proud to offer this now for patients. It's helped several patients already, and look forward to using it in the future. So if this is something you would like, certainly if you're on insulin, your health insurance would probably pay for that. And then if you wanted, we could also talk about a home Dexcom that you could use long term. If you don't have health insurance, want to pay cash, or you're not on insulin and insurance will not cover it, come in and talk to us. We'll see what we can do, see what it would cost you to get one set up. But it's usually not terrible, but it's not real cheap either. So anyway, thanks for tuning in. I hope you got something out of this video. And if you like the video, if you like the clinic, like and subscribe. It really helps out. We're trying to get more and more videos out, so anything you're interested in, let us know in the comments below. If there's a video you'd like to see something on, a topic you'd like to hear about, please let me know. I'll be glad to talk to you about it. We'll get a video put together and posted. Thanks again, and I'll see you in the next one.